Before I came rural, I had a bit of an existential crisis. I mean, what is my purpose here as a human being? What is my purpose in life? As a junior doctor, you were the cogs that made the hospital machinery turn, and it's very easy to lose sight of the difference you're making in people's lives. Every Thursday, I get to go and do the chronic disease clinic out at Cherbourg. Cherbourg is one of the original missions that was set up by the government when they took away the stolen generation from communities up north, and it's one of the largest Indigenous communities in Australia. They've always been a community that suffered from health, social and economic deprivation. Working in an Indigenous community, treating Indigenous patients with chronic diseases, a small change that you make or a small change in health literacy that you offer them can make a massive difference long term. If you make a connection with one patient and you help them in some way, they're more likely to go away and tell their family, and that news will spread that there's a doctor at the hospital that's willing to listen and that has expressed an interest in staying in the community. And that in itself is therapeutic, and that can make a bigger difference to people's health than alterations of small doses of antihypertensive medications can. It's a wonderful feeling because I got into medicine to make people better, and it's a nice feeling to have that fed back to you, and it justifies your career choice. And when that flows onto an entire community and you see it flowing onto an entire community, it's just an absolutely wonderful feeling. Being a doctor in an Indigenous community and seeing that immediate feedback on your acts, on your treatment of patients is really tangible, and the feeling you get justifies yourself as a person and as a human being as well. Because after all, we're all here to help each other, aren't we? I find being a rural generalist is so customizable. I can choose the hours that I work, and I can then come home and spend time with my family and work on my farm. I think once you come out of the country and you have all this open space, and then you can go into a community and be a doctor, it's just so life affirming.